Hello, good afternoon. My name is Christy Kadik-Ball. I'm the behavioral health consultant at Women's Health Center at UTRGV School of Medicine. And I work at an OBGYN office, a residency training program. Welcome. And today we're going to be talking about breast health and breast cancer prevention. In particular, some frequently asked questions that will hopefully get you to have your first screening if you've never had one, or back to have another screening if you've already started.
Hi, everybody. My name is Joanna Garza. I'm also a behavioral health consultant for the School of Medicine at one of their family medicine residency programs.
So Joanna, can you speak to your experience working with patients that have had a new cancer diagnosis? Have you seen that it can change their perspective on life, their values? Can you speak to that a little bit?
I think it can change a lot of aspects of life. There could be mental health complications. Maybe it can be disrupting their sleep. And so a lot of other complications, which I'm sure you probably have more to plug in with that. But then also even just adjustment of their values. Maybe getting this diagnosis kind of helps them refocus on what is important to them, reconnecting with their family.
And if there are more problems with energy and sleep disturbances, concentration, it could be that a person is having difficulty adjusting, and it can turn into sometimes depression or anxiety, mood disorders as they're going through treatment, but it's not necessarily the case always. Sometimes that does happen, and if you notice that you're just not like yourself, it can be a normal part of just learning and processing this new stage of having to access treatment and the uncertainty of what might happen. And then that can be a normal, natural part of it, but it can get to the point where if it's just really affecting your mood, and most of the time for longer than 2 weeks, almost every day, you just have a sad mood or you're more anxious, that could be a sign that you need to come in and talk to a clinician, your family practitioner, your family doctor, your OBGYN. Those are two great places to start for women and for men. Where your mental health can be addressed in a primary care setting. We're in a pandemic right now. Everybody is feeling more stressed, or a little bit more sometimes with changing mood as you're watching the news, or you might be grieving also family members. Or just changes in your life situation, adjustment to not being able to go to graduation or celebrate birthdays. We're all going through that. If at any point you feel like you need help and you don't know where to start, your family medicine physician, again, is a great person to reach out to. And also your OBGYN is another great office to have that initial discussion. So when you go for your for your screenings, bring up that you're not feeling like yourself. If you're not sleeping, if your mood has changed, they're going to know what to do. They're trained in this, and again, you can come to our offices, but any OBGYN or any family medicine physician can help. At this point, we're working to bring down stigma around mental health, and mental health affects physical health, and physical health affects mental health, and they interrelate. So to be healthy as a whole person, you have to address both. So I encourage you, if you do feel like you're needing help, to reach out.
All right, Christy, well, I think that concludes our little mini session. Thanks everybody for tuning in. And again, reach out to your physicians out at UT Health for any questions.
Thank you, Joanna. Thank you everybody for listening, taking the time. And all over the lower, mid, and upper valley, we have UT Health clinics with clinicians that can help in whole person care. So come see us and have a wonderful evening, everybody. Thank you, Joanna. It was fun chatting today.
Yes, absolutely. Thanks, Christy.